you're right.
Yeah.
Okay, sacroiliac mobilisations. So these are low impact, gentle mobilisations of the sacroiliac joint. We're not trying to reposition a misaligned joint, simply to create motility and movement in the joint and stimulation of the joints to allow them to find their own natural healthy alignment. So the first one hand roughly in the L5S1 area, the other at the tip of the sacrum, and we use a gentle pulsing movement, pushing down with the lower hand to move the sacrum in relation to the pelvic bones. So it's press, a very smooth progressive progression, release. And you do this for half a minute, maybe up to a minute, and it's mobilizing the sacrum, and it's also creating a little stretch through the lower lumbars. So that's the first one. The second one, you can do this easily on either side, but one hand on the pieces, the other on the ischial tuberosity. And the mobilization is a rocking action between the two hands. So it's pressure onto the ischial tuberosity and then pressure onto the pieces. Again with a slow, smooth rocking action. And the idea here is that we'll be gently moving the pelvic bone in relation to the sacrum. There's some movement that will go through the sacrum into the lower lumbar area, so you're getting some other sort of effects, and we can do that easily on either side. And you do these later on after you've done a lot of soft tissue release around the SI joint, around the surrounding tissues in the lumbar area, the buttock, the thigh. This will be done later on in the treatment. Okay, so those are the sacroiliac mobilisations with the person lying face down. If you'd like to roll over onto your back, Joe. Okay, with the person lying supine, we find the two aces, and two ways to do this. One is to fix one aces. I'm fixing her left aces, and then I pulse the pelvic joint with a slow pressure in release to move her right SI joint. This one often has quite deep systemic effects on the pelvic organs, so you get sort of releases deep inside. Then I swap over and I can get a very good sense from doing this of the overall motility of the pelvic joints, and if one of them is feeling fixated, I can concentrate on that one. I can also do it bilaterally by an equal pressure in to both. This tends to be very beneficial for most SI joint dysfunctions. It's important that the idea is that you're not simply trying to press down and widen the pelvis. It's the feeling of letting it release and come back in. It's creating that little spring in the SI joint. You're not trying to reposition it specifically, simply to restore its natural motility. Okay, you can also do this, this is useful with pubis symphysis syndrome, with one hand on the SI joint, sorry, one hand on the ASIS, the other hand on the pubis symphysis, and a very, very gentle mobilization. There's a lot of emphasis on the relaxation phase of letting the pelvic bone move back, which will help with pubis symphysis syndrome. The last SI joint manipulation we do, this is done as a contract-relax procedure. We bring her knees up, and the first one, we create a counter force on the outside of the knees. She takes a deep breath and then pushes her knees out to a count of 6. 1, 2, 3, 4, 5, 6, relax, and she relaxes completely. We do that 3 times. Then the alternative, we create counter force on the inside and she pushes her knees together. A deep breath, and 1, 2, 3, 4, 5, 6, relax, and she releases. And this, the force of this goes into the SI joint, into the pubis symphysis, and again, as the pressure builds up and then releases, it creates a little spring in the joints, which will allow them, if they're misaligned or locked, to reset. If they're loose and floppy, it's helping to tone the ligaments and to firm the joint up. It's always important to realise that ligaments are not inert tissue. They do have proprioceptive receptors and they have contractile tissue. To a certain extent, it is possible to tone a slack ligament. There's a point which a ligament gets stretched, beyond which you can't tone it effectively, but in many cases you can improve the tone of the ligament using exercises like this. So the other thing is just a little reminder of things from the general massage sequence that are useful pelvic and lumbar stretches and mobilizations. We have the simple knee to chest, which can be done as a mobilization. It can be done as a stretch, and can be done bilaterally, and we can have a rotation in that, or a side bend.
That's getting the spine as well, isn't it?
Yeah, this is very much a lumbar. You can also, as you do this, create quite a good feel into the sacrum, and you can, if you feel it's stuck in any one position, you can actually use the legs to create a little pulsed pressure into the sacroiliac joint where you feel it's hanging up as well. So you actually have another little SI joint manipulation there. You have, from the general massage sequence, the $500,000 roll as a lumbar mobilization and stretch, and we had on the general sequence we had the lumbar rocking like this, which is also a good mobilisation to be used in conjunction with the fascial release techniques. Just pop back onto your front again for a second, Johanna. Other useful things that benefit the lumbar area are this little sequence of stretches. A leg lift. We have the simple leg lift. We can add a turn into it. We can also bring the leg down. This is going to open up gluteus medius tensor lateral fascia. We can have a stretch down this way. And the leg lift is going to very much go into the psoas muscle. You add some spinal mobilisation. It's a useful technique to have at this point in your treatment. And of course, just rocking is an excellent mobilisation. Okay, just one other thing that's come into my mind. Pop yourself on your back again. I think we did this in the general sequence. I can't at this point in time remember without looking at the notes. This is a very good piriformis stretch. Is you put one leg across like that, bring up the other, and you're stretching that way. That will create a good piriformis stretch in here. And all these stretches can be done either as passive stretches or as contract, relax, active stretches. Okay.